Hello class, this is week 4, and this week we will be taking a look at ADHD, attention deficit hyperactivity disorder, as well as emotional and conduct disorders within children. So let's dive right in, shall we? Attention deficit hyperactivity disorder, ADHD, really is a problem associated with short attention problems and excessive motor movements. So ADHD really is very complex. It's a complex condition that presents real challenges for caregivers and for teachers. So awareness of ADHD has significantly increased in the past few years, and thankfully, due to that research, we have a much greater insight into how to handle the challenges that children face with ADHD. It's important to note that it is a lifelong condition, and it has a negative impact on an individual's social, educational, and educational life. Really, the identification of a student with ADHD requires a physician's input. It is not primarily something that an educator would diagnose. So it's important to keep that in mind. And in most provincial educational jurisdictions, they do not list ADHD as a distinct category of exceptionality. Therefore, children with ADHD may qualify for services under other categories. For example, behavioral disorders or learning disabilities. It's also important to really attach yourself to some resources and avail yourself of the resources of the professional associations. So, for example, the Canadian Attention Deficit Hyperactivity Disorder Resource Alliance, the CADDRA, produces very practical practice guidelines for professionals who will be conducting research on or treating patients with attention deficit hyperactivity disorder. And if you're working with people with attention deficit hyperactivity disorder, it's really valuable to delve deeply into the research and to understand the background of the research. And so I would encourage you, if this is an area that you want to specialize in, to take a look at their website, and that is at www.caddra.ca. And I know I've mentioned the IDEA legislation in the United States before, the Individuals with Disabilities Education Act. And under that act, it really ensures services to children with exceptionalities throughout the country. And this act governs how states and public agencies provide services. So, for example, early intervention or special education, and across the age span, so from infants and toddlers to children through to youth with exceptionalities. In 1999, around there, the definition of other health impaired, or OHI, was actually amended, and then they added in ADD and ADHD to the list of conditions that could render a child eligible under this Education Act category. So, whatever jurisdiction you're working in, there should be adequate support for you if the child is identified. There should be programs in place that you can access. So, let's take a look a little bit at the basic concepts. What is ADHD? Really, first off, it's invisible. It's a hidden disability. And sometimes ADHD is something that is not on your radar to start with. But once you've worked with children for a while and you have seen how they act and behave, you will, and you have the definition of ADHD in your mind, they're really not that hard to spot when you get into, say, for example, the classroom. Individuals with ADHD really struggle with being attentive. They don't seem to listen. Their minds seem to be somewhere else a lot of the time. The work that they turn in tends to be messy work, with some careless errors within it. Sometimes they may not finish their work, or the work may be finished, but they just don't bother turning it in. They have trouble organizing and may start one task and then shift to another before they complete the first task. They really don't perform what you would expect based upon their ability. They have a tendency to squirm, to talk excessively, to jump up out of their seat or interrupt the teacher at inappropriate times. They just struggle to control themselves. And that really kind of brings you to the core of this. This isn't necessarily that the brain is working too fast. It's that the parts of the brain that organize and control are working too slow. So there is this kind of activity that goes on. ADHD is a developmental disorder. Typically the onset is before the age of 7. And ADHD in many cases, as I already mentioned, is something that causes a lifelong struggle. It becomes to the fore in the classroom because of the structured nature of the classroom. It's a disorder that has an impact on an individual's success. It appears across cultural, racial, and socioeconomic groups. And it will affect children of all levels of intelligence. Now, to really understand ADHD, it's valuable to look, for example, at some of the other terms used to describe ADHD over the history of trying to understand this disorder. One of the terms that was used in the past was hyperkinetic disorders. And this really kind of describes part of what is going on, where there's this excessive movement, this need to be constantly be moving. ADHD primarily refers to deficits in attention and behaviors characterized by impulsivity and hyperactivity. When we look at the psychological diagnostic criterion and the psychiatric criterion, when we look at the Diagnostic and Statistical Manual, it classifies ADHD as a disruptive behavior disorder that is really distinguished from other disruptive behavior disorders. So it's not a conduct disorder, it's not an oppositional defiance disorder, but there are 4 types of ADHD. There is ADHD predominantly inattentive type. There's ADHD predominantly hyperactive impulsive type. There's ADHD combined type, and there's ADHD not otherwise specified type. Now, what is the prevalence of ADHD? It is really one of the most common child behavioral disorders. The estimates of the prevalence of ADHD in school-age children range from a conservative figure of 2% to a liberal figure of 30%. Whatever the case may be within that, you're going to be dealing with children with ADHD. Boys are more often diagnosed than girls, but as professionals and parents discover and begin to recognize the importance of diagnosis, that number, that gap between males and females is closing. Now, according to the Canadian Pediatric Society, the prevalence of ADHD in school-age children ranges between 3 and 5%. We could probably go with that number. The extreme differences found in prevalence figures really reflects, in my opinion, the variances in the definitions and the assessment procedures, and the lack of understanding that we still seem to have to some extent with ADHD. Now, the exact cause of ADHD is unknown. However, we do know some fairly significant things about ADHD. First off, we know that it's neurologically based, that it's related to the cytoarchitecture, the neuroanatomical brain structure, that it is neurochemical, that it's related to a chemical imbalance in the brain, a deficit of chemicals that regulate behavior. It's largely dopaminergic, so the role of dopamine is significant in this disorder. It's neurophysiological, so there is a disruption of the function of the brain. And it's also neuropsychological, so there's a dysfunction of the frontal lobes that result in deficits of executive function, having to do with, and this is something I've already mentioned, deficits in attention, in self-regulation, in impulsivity, and in planning. So there's a whole combination of causes that are likely involved in this cluster of symptoms that we call ADHD. Now, although the precise cause may never be clearly understood, we do have a good sense of how to pinpoint educational strategies and medical treatments that will help deal with the problem. Now, let's just talk a little bit about the nature of ADHD. So, what are the characteristics of ADHD? And how do they manifest themselves? Really, they manifest themselves in 3 common areas of struggle. First, the limited, sustained attention or persistence of attention to specific tasks. Secondly, there's reduced impulse control or limited delay of gratification. And 3, excessive task-irrelevant activity or activity poorly regulated to match the situational demands. So these characteristics are prevalent in many individuals, particularly young children. But the ADHD characteristics and behaviors occur to a far greater degree and at a higher frequency in individuals with ADHD. Symptoms are likely to change from one situation to another. So, more ADHD symptoms may be shown in, for example, group settings or during a boring work situation. For some adults, the effect of ADHD will linger, but it will change somewhat. So, hyperactivity involving might evolve and change into a general feeling of restlessness. Now, many adults with ADHD are very successful, and there are a number of reasons that this may be. Some professionals or some professions have a built-in support for personnel, such as computer operators or admin assistants or accountants. Some jobs have built-in accommodations such as frequent travel or a stimulating work environment such as a hospital or a high-volume sales floor. So there's a lot of variety and a lot of movement required. And some jobs require personal qualities frequently found in individuals with ADD, such as extroversion, spontaneity, humor, energy, risk-taking, multitasking, and entrepreneurship. So there are some, it's not all negative, the experience of ADHD. The key is being able to manage your ADHD and also finding the role within life that best fits how you function. There's a large part of success for a person with an exceptionality really is the self-determination, the choice of the career type, and the persistence that the person has in striving towards success that really plays a huge part within this. Now let's look at the role of identification and assessment and the eligibility for services, particularly for children, because that'll be probably what you're more interested in. So for years, the ADD diagnosis and the related assessment were really considered the responsibility of psychologists or psychiatrists and physicians. And in Canada, the identification of an ADHD diagnosis ultimately does require the involvement of a physician or a psychiatrist. But teachers are often involved in the assessment of the student with ADHD because they are familiar with the specific behaviors and the commonly used assessment techniques associated with ADHD. Now, as soon as the school suspects that a child is experiencing attention problems, the parents should be notified and invited to meet the educational school team to discuss and respond to the observations of the school personnel, and to be invited to describe their own experiences with attention problems outside the school setting for the child. And with all of that information, the parents are invited then to determine whether or not additional testing is needed. And there are a variety of methods and assessment procedures that really will be needed to gather the appropriate information to evaluate the presence of ADHD in a child, including observations, interviews, a review of intellectual and academic testing, review of school records, rating scales, and in some cases, medical exams. Now, after all of the assessment data has been collected, a meeting should be called to all participants to discuss the findings and all of the recommendations. Now, the Diagnostic and Statistical Manual criteria for ADHD really should be considered. That is, after all, the clinical guideline for understanding ADHD. And the team should look for consistency across reports from all of the assessments and from all of the informants. Now, after the education plan has been developed, the parents and the school personnel should really monitor the child's progress, and adjustments should be made as they are needed. And as the setting and the school personnel change from each year, it should really be evaluated to ensure that everyone is on the right track for helping and supporting the student. As far as cultural and linguistic diversity, there is, of course, ADHD is going to coexist with cultural and linguistic diversity, and it's going to present its own special set of challenges to the educator. For example, teachers will need to become familiar with the students' unique values, views, customs, interests, and behaviors, and their relationship to the educational strategies. Now, of course, a chaotic home is going to exacerbate the problems of a child with ADHD. Homes of many children with ADHD may seem disorganized, and the parenting characterized by inconsistencies or a lack of structure. And so the teachers in schools should seriously question the judgments of some and give significant attention to the influence also of the home life of the child in order to understand the experiential background of the child. Because this may be, the symptoms may be simply not a neurological disorder, but a reaction to the experiential background of the child. Now, of course, there are adaptations and accommodations that are important in both assessing and teaching children with diversity. And so we always need to keep in mind. However, in the end, it's important to remember that this is at the core. If the child is diagnosed with ADHD, that they have a recognized neurobiological disorder. And fortunately, we understand it enough to understand the fact that there are parts of the brain, particularly within the frontal lobe, that are not firing adequately enough. And that is resulting in the disorganization, the lack of ability to plan, the lack of control. And so we have medications that can be prescribed by physicians for ADHD. And teachers need to understand the many different types of medications used to treat ADHD. And these are commonly prescribed medication. And there will have the teachers that really engage in this will begin to become familiar with the commonly prescribed medication dosages, the intended effects of the medication, and also the potential side effects of it. Overall, about 70 to 80% of cases, children with ADHD respond positively to psychostimulants. So some of the most common psychostimulants are things like Ritalin. Ritalin has been around for decades. Concerta, Cylert, or Adderall. All of these do a significantly good job of activating the parts of the brain that will be required for getting the behavior under control. Because the psychostimulants are the most frequently prescribed medications, teachers need to be aware of the side effects of some of these medications. Now, for example, students with a family history or who have a diagnosis of Tourette syndrome are generally not given something like Ritalin. And so there needs to be some other types of medications used. Because a large part of the neurochemistry of ADHD is dopaminergic, involving dopamine, there are a certain type of antidepressants that are also dopaminergic. Now, antidepressants typically are serotonergic, or focus more on serotonin, but as they become more sophisticated, some have focused on dopamine. And so we know that certain antidepressants will work as a second major group of medication, and so it's the second major group prescribed to students for ADHD. Now, the thing that we need to keep in mind, though, is that they're not prescribed as frequently as the psychostimulants, because the psychostimulants have a direct effect. The antidepressants have a secondary effect upon this. So overall, teachers will need to monitor the positive effects and the side effects of the medications used to treat ADHD, and to be in discussion with the parents, and for the parents to be in discussion with the physicians to understand how to help the child as best as possible. Now, it's important to keep in mind, of course, that not all children with ADHD need medication, but medical intervention is always appropriate for ADHD, in whatever form it may take, whether it be simple guidance or whether it mean pharmacological interventions. So, overall, in working as a teacher or early childhood educator, teachers should know what medications can or cannot do. And they should realize that medication alone largely is insufficient for managing ADHD. ADHD is something that requires a multimodal approach. And so we always need to keep in mind that it's important to be engaged with the parents and with the children and working with them. It's also important to be mindful of quick fixes. There is no real quick fix. This is a lifelong challenge. But recognizing that there are different practices that can help to support and improve the function of the child are available. So it's always important to be working as a team, working together to help the child with exceptionality. Extremely important. Okay, so that's it for ADHD. And let's go on now and talk a little bit about students with emotional or behavioral disorders. And you know, when you work with children, most children are disruptive from time to time. The majority, however, do not display negative behaviors sufficient to create serious problems within, for example, a school or a daycare center. Students whose behaviors or emotions result in significant problems may require some identification and some intervention. Students with emotional and behavioral problems can receive a variety of labels, and these labels aren't necessarily a negative. They're there to help the child, to help the professionals to be able to identify the struggles that the child has and to formulate well-researched strategies for dealing with the child. Now, like with every exceptionality, there are people that are concerned with dealing with a specific group of challenges. And just like that, there is the Council for Children with Behavior Disorders, the CCBD. And This is a group that researches and formulates strategies for children that are emotionally disturbed or behaviorally disordered, because it believes that the term that term better describes the students and how they can be served in special education programs. Now, the basic idea behind this is that emotional or behavioral disorders can be understood as a broad range. For example, in Canada, no single definition of emotional or behavioral disorders is in use in schools. Even within provinces, there seems to be a significant amount of variability about understanding and how to really categorize this. But there are some commonalities that do exist in what constitutes an emotional or a behavioral disorder. And these really include behavior that goes to an extreme, that is significantly different from what is normally expected. A behavior problem that is chronic and does not quickly disappear, or a behavior that is unacceptable because of social or cultural expectations, or a behavior that affects the student's academic performance, and behavior that cannot be explained by health or sensory or social difficulties. So, in some ways, it's a bit of a catch-all for a lot of disorders. But when you work with child for a period of time, you get to get a sense of what is normal, and so it can be a very useful classification, emotional and behavior disorders. Now, students who experience emotional and behavior disorders really are a really diverse group. According to the DSM, the classification system will categorize emotional and behavior disorders into several different clinical subtypes. But remember, the DSM, the Diagnostic and Statistical Manual, is a psychiatric system, and so sometimes that doesn't translate easily to educators. So when you're working in the field of psychology, you kind of have to bridge that gap a little bit. The classification schemes used by educators are usually associated with functional behaviors and have related interventions. But some useful categories or subgroups of children with emotional behavior disorders are, for example, conduct disorders. So a child that seeks attention or disruption or acts out, and this includes behaving aggressively towards others to an extreme, is a conduct disorder. A socialized aggression, so they likely join a group of peers who are openly disrespectful to other peers, to teachers, to parents, are commonly seen in delinquency or truancy or gang behavior. Would be another one of these emotional and behavioral disorder groups, subgroups. Attention problems and immaturity. So they have attention deficits, poor concentration, and are easily distractible. They have impulse control problems and act without thinking about the consequences. Okay. Remember that this group of six subgroup of category that I'm speaking here is an educational subgroup. So not psychiatric, but educational. Then there is anxiety or withdrawal. So those that are self-conscious, are reticent and unsure of themselves, unsure of their self-concept. It's very low self-concept. It causes them to retreat from the immediate activity, and they're anxious and they're frequently depressed. That would be the anxiety withdrawal group. Then there's this psychotic behavior group. So the child may hallucinate or deal with the fantasy world, or talk in gibberish, or display very bizarre behavior. That's another group. And then the motor excessive, the hyperactive. They have difficulty sitting still. That would be another group. So with collaboration with other professionals, it's really helpful for frontline workers with children to be familiar with classification systems such as this educational subgrouping. But it's also important to keep in mind that the classifications become less important to design educational programs for dealing with the functional assessment or the intervention model, because we need to deal with the specifics of the child. Now, what is the prevalence? Prevalence rates really vary dramatically across Canada. And because of the difficulty to define and identify emotional and behavioral problems, it's hard to say. But the one thing that we can say is that emotional and behavioral disorders are identified at a far higher rate within males than females. Some characteristics of emotional and behavioral problems. They exhibit a wide range of characteristics that differ in type as well as intensity. So these are going to include aggressive acting out behaviors, social deficits, inadequate peer relations, hyperactivity and distractibility, lying, cheating, stealing, academic deficits, language disorders, depression, and anxiety. Now, a common way of conceptualizing emotional or behavioral disorders is to categorize them as externalizing, so a temper tantrum, or internalizing, such as fear or anxious behaviors. And that can be a helpful way to distinguish them as well. Now, as far as identification, assessment, and programming for dealing with children with emotional and behavioral disorders, they're really evaluated for several purposes, particularly within the educational system. So there's the identification, the assessment, and all with the eye of determining the appropriate intervention strategies and to determine the eligibility for special education services. And there's a number of different assessment procedures that are used, including clinical interviews, observations, rating scales, personality tests, and neurological examinations. And so that whole team approach, again, is a huge part of it. One of the major parts of determining appropriate intervention strategies is what is known as the Functional Behavioral Assessment, the FBA. And this is a major part because it focuses on abilities to succeed in daily activities. And it provides an extensive amount of information for teachers to understand how the child can function and how the child can function safely. And so there's some challenges in this. There are strategies for curriculum and instruction. So students with emotional and behavior disorders may act out and create disruptions in the classroom, and their behavior may affect not only their learning, but the learning of others. And so there needs to be significant discussion whether or not it's appropriate to provide inclusion for a child with emotional behavior disorders. Although I will be very clear here that all provinces and territories are committed to the inclusion of children with emotional and behavioral disorders in the regular classroom. So the question is, how can this be done in an appropriate and safe manner? And that is why the team is so important. Emotional and behavioral disorders and inclusion includes thinking up a variety of services. So, for example, what is appropriate placement? Is appropriate placement the classroom and on one end, or it can be pull-out methods, or sometimes in consultation with the parents, it can be a hospital setting. So it really it's important to work as a team to make the best decisions to ensure that children are safe and that the needs of the child are met. So it's important to understand the specifics of the disorder. It's then important to devise effective instructional strategies for the child. That may be modifying the curriculum. It may be having a full-time aide for or instructional assistant for the child. It may be that the child is given their own specific context and given full attention by adults. It may be that the child requires social skills instruction. Students with emotional and behavior disorders often display social skill deficits. And so that may be a significant part of the focus within this. And we will stop there for this week.